Campaign 2018 is sponsored by Wisconsin Hospital Association, Wisconsin Counties Association, Wisconsin Realtors Association, Marshfield Clinic Health System, and Campaign 2018 partner Milwaukee Journal Sentinel.
WisconsinEye is on the campus of Gateway Technical College in Sturtevant, interviewing John Leiber of Racine. He's a Republican candidate in the 62nd Assembly District. John, welcome to WisconsinEye.
Thanks for having me, Steve.
What do you consider the top issue in your campaign?
Well, I think the biggest issue I've been hearing out on the doors is the big Foxconn investment. People are generally supportive of it in the area. Obviously, it's located in Racine County, and my district's entirely in Racine County.
The people you meet support it, think it'll be a boom?
Most people do. Some people are concerned about some of the issues. They want to make sure we actually get all the jobs that were promised. They used to be worried about the environmental concerns, but there have been some recent announcement about advanced pollution control technologies they're going to implement, so I haven't heard too much of that lately.
So you're hearing about Foxconn on the doors. What other issues are you hearing about, sir?
Well, transportation funding is obviously a big one, not just here, but around the state.
So how would you pay for our highway future?
Well, that's a difficult one. I don't support increasing the gas tax.
You do not?
No. I don't think the gas tax is a sustainable way to fund our transportation going forward. With fuel efficiency increasing, electric cars, the gas tax is going to make an increasingly smaller and smaller contribution to the transportation fund. I've heard some other ideas out there, so I'm willing to kind of explore some, maybe dedicating some more funding towards transportation without raising the taxes. That seems promising.
The buzz in the Capitol about tolling, your position?
I really don't like tolling. I'll say whenever I go down to Illinois, even if I have to use 94, I try to go around it. Use, what is it, Highway 41. I really don't like paying for tolls in Illinois.
You don't?
No.
Okay. They're talking about Foxconn and they're talking about transportation. What other issues are you hearing?
Well, one of the general ones is people are a little upset how polarized things can get, not just nationally, but also locally. And I think I've been going out talking to people from both sides at the doors, and just a willingness to listen to different views. I think people are a little concerned that there's not as much conversation as there should be between elected officials of both sides.
Okay, let's work through some issues. With the backdrop of school shootings and mass shootings, do we need to change our gun laws?
I don't believe so. I believe increased enforcement of the existing laws and finding ways to make our schools safer. That's obviously the biggest area people are concerned about. So I think the school safety grants that have been announced recently and are continuing to be announced around the state, that's a good step forward to making our schools safe and making people feel more confident that they're not going to be a victim of that.
Local governments have lived with levy limits since 2006. Some local officials say their word is strangling their ability to provide local services. Do we need to keep levy limits, dial them back, or get rid of them?
I think we need to keep the levy limits. I certainly understand the concerns of municipal leaders facing difficult budgets, but we also have to look at the impact that's going to have on taxpayers. The levy limits were put in place so that taxpayers, especially those on fixed incomes, won't see a huge rise in their tax bill year to year. So there are ways they can raise money without increasing their levy limits, such as referendums. That requires a vote, which I think is the appropriate way. If you need more money from the taxpayers, it's only right to ask them for that.
Healthcare. What are you hearing about healthcare, and what next steps should the state of Wisconsin take in the healthcare debate?
Well, last session, the Assembly passed a bill about pre-existing conditions, and from the number of representatives I've talked to, it sounds like that's going to become an issue again next session. And I look forward to working on that and making sure that Wisconsin residents actually are able to find affordable health insurance if they have pre-existing conditions.
Healthcare in rural areas has unique issues. You have older residents, you have household income less than the statewide average, you have young people leaving, you have more and more healthcare being provided by either Medicaid or Medicare. Thoughts on how to improve and keep quality healthcare in the rural areas?
Well, that is an important issue. My district, partly urban, but also partly rural, and access to healthcare is an important issue for everyone. I think the state does have some role to play in that, but as a partner working with the local areas, trying to figure out what's the best way to recruit and keep the medical practitioners they need in certain areas. And I know that's going to become an increasing issue as the Wisconsin population ages, as rural areas are facing unique challenges compared to urban areas. So I think that is something the state's going to have to look at in the future, and ideally we address that before it becomes a critical issue.
So does the state government then have a role in recruiting and retaining doctors, physicians, and other healthcare professionals?
I think it does have a role, but I think not a sole role. I think it needs to partner with the local areas, local hospitals, and try to figure out what kind of program would be best to work with, providing incentives perhaps, or just kind of creating an atmosphere where medical practitioners actually want to come and work in the area.
Current state budget included a big bump in state aid to K-12 schools.
Mm-hmm.
Some say it's not enough, that we need another big bump next budget. What's your thought?
Well, it's a perennial issue, as you know, or biennial issue, I suppose you could say.
Yeah, 2 years.
Yeah. So every year, the state budget has been allocating more funding for education for the past 6 or 7 years. And I know we're now spending more on K-12 education in actual dollars than ever before. You have to couple that, though, with the realization that the student population's relatively flat right now. So we are spending more money, but the population is increasing, so we're spending more and more per pupil every single year. I would try to look at and see what the funding formula actually does right now. Most people don't understand how the formula works. It's a very complicated system with primary, secondary, tertiary funding levels. There's additions, subtractions based on movement and assessed value. So I would take a look at revisiting that formula, seeing what makes sense, because I don't really like the way that instead of putting money in the formula, we have to add more per pupil funding. It's a way to get around the formula because the formula is not working. So I would look at that formula, try to find a way to make it work better, or kind of revise that.
Voucher program, choice program, started out in Milwaukee, expanded to Racine, and now statewide.
Yes.
2 questions. Has it generally been a success in your hometown, and do you think it should be expanded further statewide?
I think it's been a huge success in Racine, just judging by the popularity of it. It started again just not too many years ago, and there are, as of the last reporting period, 2,900 some students participating in that. And I think some of that has to do with students' parents wanting another choice other than Racine Unified, the big school district in the area. But I also think it shows that parents are looking for the student that best fits their child's educational needs. And I think there was a huge pent-up demand for that. And once this program started, you saw a lot of parents, a lot of students looking into this, and ultimately nearly 3,000 are participating in it, out of a public school population of 19,000 now. So that's a lot, and I think there is still even more demand for that. Just in Racine Unified, again, the area where the choice program is, 1,200 students are open enrolling to other public school districts. So there is a lot of pent-up demand, and I think I'd like to see it expanded and around the state so that other parents in other communities actually have the same choice we do here in Racine, have the same choice they do in Milwaukee. Right now, there is a statewide program, but it is somewhat limited. So.
A big item, a big debate in the next budget will be whether we need a new state prison. Waupun and Green Bay are built in the 1800s. We're closing the 2 juvenile facilities. Do we need a new state prison?
Well, I haven't looked too much into the state prison. It's not a huge issue here. I would say generally, though, if there are people being sentenced to serve time in prison, we actually need to have space for them. I wouldn't want to see a prisoner being released solely because of not having enough space. I think if they were sentenced to a certain term, they should serve it.
UW system funding, we've had a tuition freeze for resident undergrad tuition for 6 years. Should that be extended into a 7th and 8th year?
I believe it should be, yes. I think providing affordable access to education for Wisconsin residents is vitally important, especially in the economy we see now. I support doing that. UW system, I support the UW system and providing it with the funding it needs. but we also need to look at what the students need, and they need to be able to actually afford going to college and graduate and work in our economy.
Is it time to legalize either recreational marijuana or medical marijuana, John?
I would not support legalizing recreational marijuana. The issue of medical marijuana is still kind of being researched by, for example, the FDA recently approved one type of drug that's derived from cannabis. I think that's the correct way to go through the regulatory process, follow the research, and wait for medicine to actually be approved by the authorities. Just a legislator just deciding that this is medicine, this probably isn't the best course to go.
We've passed a number of HOPE agenda bills dealing with the methamphetamine, heroin, and opioid epidemic. What next steps might the state take to fight those epidemics? Well,
I think, first of all, I'm encouraged by all this progress that has been made, a lot recently, of course. So I think we need to see what effects the current programs have, and go from there. I'd like to see how effective some of the more recent legislation's done. I know providing Narcan to first responders has saved lives. I'd like to see what some of these current reforms do and build off of those before I propose anything based on that research.
If you're elected, what do you think might be the first bill that you ask to be drafted and sponsored?
Well, I think based on what's in the district, probably something dealing with the after effects of Foxconn coming in. There may be some changes that need to be made or some adjustments. I think that's going to be a huge issue in this area, and I think it's only natural for Racine County legislators to take the lead on that.
Democrats, as you've heard, say don't trust Foxconn. Now you've obviously, it's such an integral issue in your district.
Yes.
You believe they can be trusted to deliver the $10 billion investment up to 13,000 jobs?
I do. I've always liked Ronald Reagan's saying trust but verify. So we do trust them, but we also want to make sure that they're following the contract same as we are. So I'd like to make sure that we get what we were promised, they were promised. If everybody gets what was agreed to, then everybody wins.
Primary August 14th, there are how many candidates?
There's one other candidate.
One other candidate. You want to highlight differences with that candidate?
Well, I would say that my experience in the legislature will allow me to hit the ground running at this critical time in Racine County.
And you were an aide for how long?
4 years as assembly staffer.
4 years as an assembly staff. So go ahead. I interrupted you. Excuse me.
No problem.
Other differences?
Well, I'm committing to being a full-time legislator, just like I'm running for office as full-time, and I also believe that I'll be able to commit my full attention to serving the needs of my constituents and my district.
Thank you. John Leiber of Racine is a Republican candidate in the 62nd Assembly District. The primary is August 14th. John, thanks for talking to WisconsinEye.
Thank you, Steve.
Thank you.
Campaign 2018 is sponsored by Wisconsin Hospital Association, Wisconsin Counties Association, Wisconsin Realtors Association, Marshfield Clinic Health System, and Campaign 2018 partner Milwaukee Journal Sentinel.